that we've set as a country. We were the first country to set such an ambitious goal. But on our route there, of course, flying remains important, even though the number of flights has fallen. One of the good things amongst this terrible virus is that the amount of cycling has increased enormously and more than doubled. So I think that we are making some progress in some areas, and clearly the lockdown has had a positive impact on reducing carbon emissions, but we also do need an airline industry as we come out of this so that people can move about. And what we need is a long-term trajectory to getting to net zero that everybody can get behind. The next question is from Sam from Chester. And Sam from Chester asks, the likes of gardens and big shops are now beginning to reopen with social distancing measures in place. When will UK zoos be able to say the same? Sam, thank you for your question. It's something that is close to my heart because because Chester Zoo is such a fantastic zoo, and coming from Chester myself, I know it extremely well. And I really hope that we can open zoos in a safe way. And I know the pressure on zoos. I've heard representations from those who are running zoos, not least because unlike some other shops that can just close, you've still got to be there in the zoo looking after the animals, and they are mostly outside. So I very much hope that we can get the zoos reopened in a safe and COVID-secure way. But of course, like all these things, it's got to be done in a way that doesn't allow the R to go above 1 and doesn't allow the virus to get out of control. Thanks very much, Sam. We'll now turn to questions from journalists. The first is from Hugh Pym from the BBC.
Thank you very much indeed. I wanted to ask a couple of questions related in one. First of all, the government's chief scientific advisor said keeping the death total to 20,000 or below would be a good outcome. It's now above 40,000. How do you assess that outcome given where we are now? And the other one was on the R number. There's been some modelling suggesting that regional variations, certainly in England, are quite pronounced. In the southwest and the northwest, it's estimated to be around 1. Is that a concern? And might there be a case for more regional restrictions?
Well, thank you, Hugh. I think the day that the number of deaths from coronavirus has gone over 40,000 is a time of sorrow for us all. We've got to remember that each one of these is an impact on a family that will never be the same again. And my heart goes out to them all. And it makes me redouble my determination to deal with this virus and to get that incidence right down. And the way you get the incidence down, exactly as you say, the questions are absolutely linked, is to keep the R below 1. And we're increasingly getting better regional data. You're right that the R is closer to 1 in the southwest and in the northwest. The advice from SAGE is that R is below 1 in all regions. However, we want to increasingly have an approach of tackling local lockdowns where we spot a flare-up. We've been doing this over the last few weeks. For instance, there was a flare-up in Weston-super-Mare, which we successfully have got under control, and making sure that we use these extra focused data, both at a regional level and then more locally than that, is incredibly important. So the new Joint Biosecurity Centre has been tasked to look into each area where there's a flare-up. Both the northwest and the southwest, which are highlighted by the regional data, are big areas themselves, and we need to get more granular and more focused and find the source of the local outbreak and then deal with it.
A quick follow-up on another subject, if I may. Michel Barnier has said that trade talks between the EU and the UK are not progressing well. What are the chances, do you think, of a no deal?
Well, I very much hope that we avoid that, because our position is very reasonable. It's that any agreement that we reach must reflect the fact that the UK is an independent sovereign state, and we're working very hard and will accelerate the work to make progress in talks by the end of the year, so that we can put into place the vision that has already been agreed between the UK and the EU, which is based within the political declaration. You know, I spend all my time working on coronavirus, and I think that given the time that's passed, it's time for both sides to work together, and we're willing to accelerate that work to get that final agreement based on a vision that's been agreed, and then we can progress. Thanks very much, Hugh. Sam Coates from Sky. Sam.
Secretary of State. You seem to be cherry-picking the most positive data, but doesn't that give an over-positive gloss to what's going on? Public Health England, the body which reports to you, said today that the regional R number is rising in many places and is above one, not near to one, as you just said, but above one in some of them. A Cambridge University study, co-authored by your very own Public Health England, suggests that the reproduction number could be above one in Liverpool and Manchester. Now, this study from Cambridge and PHE says that the R number is rising, and I quote, probably due to increasing mobility and mixing between households and in public and workplace settings. Are they wrong? And would you tell the people of the Northwest and the Southwest this weekend to still exercise all of the new freedoms given to them by the Prime Minister this weekend, or should they exercise a little bit of extra caution?
Well, I think everybody should exercise caution, Sam. I think that's an incredibly important part of what we all have to do at this point. In a way, the discussion of the higher R in the Northwest and the Southwest that's estimated compared to the rest of the country is an important part of moving towards a more localised approach rather than a national approach to the lockdown. Now, it's very important that you look at all of these different studies in the round. The study you mentioned is an important one, but the overall assessment, which is brought together by SAGE, which advises the Chief Medical Officer, is what I look at. So we've referred to the Office for National Statistics study that was published this morning on the slides. That is based on data rather than modelling. But what I do is look at all of these different studies, and the overall view of SAGE is that the R is between 0.7 and 0.9, and that it is higher in the southwest of England and the northwest of England, but that it remains below 1 in each area. Now, that doesn't take away from the need to make sure that we spot and crack down on localised outbreaks when they come.
If you had to do tomorrow a local lockdown, is the infrastructure in place to make that happen?
Yes, and as I said in my answer to Hugh Pym, we've been doing it over the past weeks, for instance, in Weston-super-Mare. Thanks, Sam. The next question is from Shabab Khan from ITV. Shabab.
House Secretary, you've said that if the R number increases, we might have regional lockdowns. You've mentioned that in the previous two answers that you've given. Many people in those areas have no idea what a regional lockdown will look like. When can we expect the guidance on what that will actually be in practice? Also, are you talking to metro mayors and local authorities in areas where the R rate is high about what they can do to protect their populations and how exactly they should be enforcing a regional lockdown?
Yes, these are really, really important subjects. As part of the overall test and trace programme that Baroness Dido-Harding is running, we have, as part of that, the engagement through, in England, local authorities and the regional mayors, and also, of course, with my colleagues in the devolved countries, because the PHE study, of course, is about England, and the same localised, increasingly localised approach needs to be taken in the devolved nations as well. So those connections are made. And in fact, we brought in Tom Riordan, who's the Chief Executive of Leeds City Council, in order to ensure that we have that connection between the measures that need to be taken at a local level and, of course, the national oversight of that. It's an incredibly important system. It's already working, as I mentioned in my response to one of the first questions, but we're continuing to strengthen it and strengthen the data feeds so that we can get more and more localized information.
You've repeatedly said that easing the lockdown, and this is from the very beginning of this pandemic starting, and you're talking about the next steps, is conditional on that R number. And the models that have been mentioned by my colleagues suggest that there are regions that are close to or above 1. So at what figure and at what point do you put the brakes on your plans to ease the lockdown? Is there a number at which you stop proceeding with easing off these measures?
Well, as I say, all of the different studies are brought together through SAGE, whose assessment is that the overall UK R is between 0.7 and 0.9. And in a way, the question highlights the need to do that and to bring all of these studies together, because today we've had news from the Office of National Statistics implying that the number of new cases is coming down to around 5,600 per day. And then we've had other studies implying that it's higher than that. And what I do is listen to all of this advice and make sure that it's synthesized, and then you get an overall view. What they do confirm across the board is that there is a challenge in the northwest of England that we need to address, and to a lesser degree in the southwest of England, where the issue is slightly different, which is in the southwest, the overall incidence of the disease is much lower, but the R, as in the rate of change of that, is a little bit higher than elsewhere in the UK. So exactly as is implied in your question, you can't just look at one of these studies. You have to look at all of the information that you have in the round, and SAGE advises on that, and the Joint Biosecurity Centre is in fact being built to ensure that we can bring all of that information together and then be advised how to act on it, whether that's at a national level through ministers or at a local level. Thanks very much, Shabab. The next question is from Gordon Rayner from The Telegraph.
Thank you, Secretary of State. Could you explain to people if there is a different R rate in the community as opposed to in hospitals and care homes? And also, why have you only just made face masks mandatory for hospital staff now? It seems like a fairly common sense thing to do. Was it purely because of a lack of PPE before now?
Well, the change that we've made in hospitals is about face masks for staff, face coverings for patients. And as we bring the overall incidence of the disease down, so we've got to make sure that we cut out nosocomial infection, as it's called, that is, infections that are passed on when in hospital. And on the first part of your question, Gordon, I've completely forgotten what the first part of the question was.
The difference between the R rate and the community.
Oh yes, of course, they were linked. So the difference is, in terms of the R rate, that of course there is a higher incidence of new cases amongst health staff and social care staff. That is shown up in all of the studies. But that is not rising as a proportion, and that implies that there isn't a different R, so to speak, in health and in social care. But the measures that you take in health, in the NHS and in social care are different. Hence, we have a whole package of work to bear down on the disease in social care, and at the same time, a huge package of work that's being undertaken by the NHS in order to get the transmission of coronavirus in hospitals right down. And it's that latter one that we're publishing more information on, and where we're strengthening the rules around face masks and face coverings in hospitals. Thanks, Gordon. Nigel Morris from The Eye.
Secretary of State, the Prime Minister has talked of a timetable of easing the next phase of the lockdown from July the 4th onwards, which would cover hotels, restaurants, tourist attractions, and so on. Isn't that now a completely unrealistic target, given the rates of infection and reproduction in, as we've talked about, the Northwest and the Southwest? And isn't the truth that the hope of a great British staycation are beginning to fade with these stubbornly high numbers? And on a second question, following your comments about this weekend's protests, would you be expecting the police to break up demonstrations of 7 or more people?
Thanks, Nigel. The thing is, I can't do anything other than come back to what I said in response to earlier questions on the R. It is important that people don't seize on one report, but rather look at all the reports in the round. So the overall view of SAGE, having considered all of the information that's come in, is that R over the country as a whole remains between 0.7 and 0.9. And critically, the ONS study, which was one of the largest studies and is based on direct measurement rather than modelling, shows that the number of new cases per day is falling and has fallen from between 9 and 7,000 as it was thought to be around a week ago to around 5,600. So you've got to look at all of these things in the round, and that confirms that the R is remains at around 0.7 to 0.9, and then we are seeking to take a more local approach to tackling outbreaks where we find them. On the second question, that is very much an operational matter for the police. The final question is from Ahmed Versi from the Muslim News. Ahmed.
Hi, Secretary of State. The Black, Asian and minority ethnic communities were disappointed with the Public Health England's review published a few days ago because the content of the review was nothing new. What the ethnic community were promised and had asked for was to find out why disproportionate number of ethnic communities are dying because of COVID-19. And they were also expecting the government to put mitigation to protect the communities. A month ago, I had asked Cabinet Office Minister Michael Gove that public health needs to look into the structural issues of racism and discrimination, which increase health risks in ethnic minorities. Mr. Gove did agree with me that the review should not only look at potential biological aspects, but he said perhaps socioeconomic structural factors which may lead to inequality, and that inequality may have been as a result of discrimination.
Yeah.
However, what was promised by them did not take place, as we can see. What is the reason behind that? And our readers are telling us that the government, it seems, does not care about ethnic minority deaths, and because the review confirms that.
Well, thank you for your question, Ahmed. The last comment pains me because we do care deeply about this subject, and that's why, following the publication by Public Health England, we're taking forward the action, and Kemi Badenoch, as the Minister for Equalities, and I are working together to take forward this point of exactly why the information, including new information, it's not true that the Public Health England report was entirely information already available, but to take forward why and also what we can do about it. Now, many of the steps that are implied, for instance, by socioeconomic factors, for instance, the higher likelihood, the bigger proportion of people from black and minority ethnic backgrounds working in occupations that are customer focused. For instance, in transport, and also in the NHS. That may well be, and I would say is likely to be, an important factor in answering this question that you rightly asked, which is why. And so the answer to that is to address the risks to those occupations, and we're working very hard to do that. And in fact, the measure on face masks, both on public transport and in hospitals, will be steps in that journey. But we've absolutely picked up that PHE report, and within government, we will now be doing the next step in that work to address exactly the question that you quite rightly ask.
I mean, can I come back, please?
Yes, of course.
Would you look at the structural issues, which Mr. Michael Gove did promise that the Public Health England would look at this review, but it didn't?
Yeah, yes, absolutely. That's exactly what we'll be doing, and taking a rigorous scientific approach to trying to understand the root causes and the reasons why. In some cases, the Public Health England report did not take factors into account such as comorbidities or, as I mentioned, occupation. That's the first starting point. But also, questions around deprivation, quality of housing are important as well, because we know that those living in lower quality housing find it more difficult to escape from a contagious virus like this. So absolutely those questions remain to be answered. So we're taking forward the PHE work. It's being done in government by the Government Equalities Office with all the support that they need from right across government, including my department. And I very much hope we can get to the bottom of those questions. But all the way along, if we find things that we can do to help reduce these inequalities, then we'll just get on and do them. Thanks very much, Ahmed. And that concludes today's Downing Street Daily press conference.
This was a press conference, and he says that the zoos will reopen safely even though he wants to. This was a special bulletin live from the United Kingdom.